Hi, my name is Jennifer Rodriguez Gomez. I'm a registered nurse RN at the MAT, Medication Assisted Treatment Program at the Lewis Center. I've been with the healthcare district for 3.5 years. I started with the healthcare district being an LPN floater, and last year I became an RN. And I like to help people. My dad was diagnosed with cancer and I was his main care provider, and I decided to become a nurse.
Hi, I'm Gail DeFeo, and I'm the school nurse at Loggers Run Middle School in West Boca. I've been a nurse at Loggers Run for 26 years. I became a nurse in 1984 when I was age 19, and I was in an ICU, and a nurse in the ICU would not leave my side. I remember still to this day I can see her face. She just assured me and assured my family that I would be okay. And she was at my bedside. Every time I woke up, she was at my bedside. And she made such an impact in my life and my family's life at that point with so much uncertainty that at that point I said to my parents, I'm going back to school and I'm going to be a nurse.
Hi, my name is Yamilet Burke. I've been a nurse here at the healthcare district for 5 years. Overall, I've been a nurse for 13 years. My family has always worked within healthcare. I originally was going to become a police officer, and I had to get a part-time job, and I started working with a urologist at his private practice, and he looked at me and he said, "You're not going to become a police officer." And I was in the process of testing everything, and I used to tell him, "You're crazy, I'm not going to do that." And 5 years later, I was still with him, and he sent me off to nursing school. He said, "You're going to be, you need to go become a nurse. That's what you need to do." So he saw something in me, and I'm 100% grateful for that.
Nursing is not just ice and Band-Aids. There's a whole lot of other things that it encompasses. The kids are most days a joy to be with. We have children that have disorders that are newly diagnosed on the school campus, such as seizures, like new onset seizures and things like that. So we try to help the parents, with follow-up support and medical care. We have critical kids that people wouldn't realize are in the school settings, and we're managing their care. And in managing their care in these critical diagnoses, it's also given the parent peace of mind that their children are being well taken care of. Some of our parents, they don't know where to turn. They don't have the means to go to medical facilities or have primary care doctors. So we also have the ability to help them find the type of medical care that they need. And then there's emotional stuff too. I have a great team of guidance counselors and emotional support people that I work with, but it's even things like just this year we had a little boy wearing slides, and he was getting in trouble because you're not allowed to wear slides at school. And I was sitting and I was talking to him, and I said, "How come you're always wearing the slides?" And he said, "I have one pair of sneakers and they're all ripped up and we can't afford another pair." So as a school community, we got him a pair of sneakers.
When you get a phone call, sometimes you think it's a complaint, and it's like, "Oh, I just want to let you know, thank you so much for helping me with the referral that you did last week."
It makes me feel good to be able to provide care to people, to be able to help them, to solve any kind of little issues that they may have. It makes me feel good knowing that I'm providing them with that service. We keep things flowing. We are an important part of the team.
I have a diabetic that during COVID, the parent withdrew she has 2 diabetics, and she withdrew the kids and they were homeschooled. And then they went to a private school just because of the numbers of the kids once they returned. And she returned here in January, and she said part of the reason was the medical care that she received here at Loggers Run.
We've had patients that have passed away even, and their families have come back to express how thankful they are.
I love my family here at the school. And it is definitely a career that when you have children, it works with their schedule. So as opposed to when you're in the hospital and you're doing all different shifts, you're home at night for homework, you're off on the weekends for sports, etc. And all summer, you're off with them as well. School nursing and being a parent, it's a wonderful job. It's medical, it's social, it's community. It's all those things wrapped up in one, and it's not just the children that depend on us, the school depends on us, and the parents depend on us.
One thing that I really enjoy being a nurse and what gives me the strength to wake up every morning and continue in this field is the rewarding of helping someone who's in need. That's one, and I believe by doing that, I can help I can help the ward to be a little bit better. In my case, working in MAT is maybe having a patient coming in, doing the vitals, getting it ready for the provider, and when I'm getting the patient ready, he or she can tell me how the day is going or something, and by me listening, it can make a difference on that person's day.